my note cards, 2 note cards, and this is my audience. I have about 6 members here. Hello, and thank you for coming to hear me speak. I'm sure at some point in your lives, somebody you know has encountered the care of a registered nurse. All registered nurses have the same basic functions, but within each department, the nurses have specialized treatments, care, and protocols that they follow. My name is Elizabeth Churchwell. I've been a registered nurse for about 3 years now, and I've worked in many different departments within the hospital. And I think it's important that everybody understands how the nurse will function depending on the department that he or she works. So I'm going to be going through the 4 most populated areas within the inpatient setting. The first nurse that the patient usually encounters is the emergency room nurse. This nurse works in the emergency department, which is fast-paced and very stressful. And these nurses specialize in a quick assessment called triage. And according to Sol Lyman Sigma of emergency nursing, the profession, the pathway, the practice, the triage process is for the nurse to determine which patient's needs are most critical so that they can begin treatment for them. Once the patient has been stabilized, the nurse will coordinate with the physician to determine if the patient needs additional observation or inpatient hospital treatment and then be admitted, or if the patient can go home and continue treatment there. If it's been decided that the patient needs to be admitted, care will be transitioned to a medical surgical nurse or med-surg nurse. And these nurses function in a department usually that is specific to a body system. These nurses care for 6 patients at a time, and they are expert multitaskers because of that, and they coordinate everything the patient will do during their hospital stay. They're also very knowledgeable in a vast amount of different diseases and body systems so that they're prepared to care and provide treatments to those patients. They're also responsible for reporting any changes to the physician. If it's found that a patient has had a critical change in their health status, then the patient will be transitioned to a critical care nurse or an ICU nurse. The ICU nurse functions in the intensive care unit or the ICU, and this area is very controlled, a very controlled environment, and these nurses see everything that the patient does. Literally every heartbeat, every breath you take, the nurse knows. So once the patient is there, the nurse will provide additional assessments, more frequent assessments, and complete watching of your vital signs. Patient, according to Landrum of Fast Facts for Critical Care Nursing, the patient ratios are usually 2-to-1 or 1-to-1, depending on the acuity of care. These patients have usually life-threatening diseases or conditions, and they need very close attention. These nurses use highly specialized equipment like ventilators to support breathing, or continuous renal replacement therapy, which is basically continuous dialysis, and it needs very precise measuring of what comes in the patient and what goes out of the patient. But patients aren't always coming into the hospital and needing to be in med-surg or needing the care of a critical care nurse. Sometimes they're there because they're going to have a baby. So that patient will be taken care of by a labor and delivery nurse. This nurse will stay with the patient during the labor and after the baby is born. The L&D nurse usually works in the maternity ward, and according to Grohl of Fast Facts for the L&D nurse, the L&D nurse will take care of both the unborn child and the laboring mother. So that's a 2-for-1 deal there. Not only do they do head-to-toe assessments, but they are very skilled, and they focus their assessments on things like the fetal heart rate and frequency of contractions of the mother. And they're also very knowledgeable in the need of critical critical assessment for the patients. Basically, when a laboring mother's condition dramatically changes for the worse, they're prepared to take that mother into the OR and usually have what's called a C-section or cesarean section performed. It's also very important that the L&D nurse provides education on postpartum care, so the mother's care of the change that's just happened to her body, and also the care of her newborn baby. So basically, as you can see, within each department, the nurse has different skills and different functions, and that requires very focused training. If you find yourself or a loved one going into the emergency room, you can rest assured that the ER nurse will take over your care and coordinate and make sure that you get to where you need to be. And if if it is that you need to be admitted, that med-surg nurse will take care of you and ensure that you are provided very well, or that you're very well educated on what's just happened to you. If you're a critical care nurse, the nurse will make sure that you are monitored very closely and continuously. And if you're in labor and delivery, the labor and delivery nurse will make sure that you and your baby are safe. So as you can see, all nurses have different functions, but they all come together and ensure the safety, quality of care, and promote patient safety. Thank you for your time.